All right, guys, so we're going to talk about the bladder now. So this anatomy, we're going to break it down, give you some more vocabulary. Talking about the urinary bladder, guys, of course, that's going to be your reservoir for all of your urine before you go micturate. It's going to be posterior and superior to the pubic symphysis, lying within that pelvic brim, which is also why whenever a female is pregnant, that baby's pressed right on top of that bladder. And I'm sure if you've been pregnant, you can relate to that. The rest of us can just imagine how horrible that must be. Can y'all concur that's rough?
Yes, it's horrible.
Yeah, my wife, Ariel, used to kick my wife's bladder constantly. She was like a punching bag, how she used to put it.
So the only difference that there'll be in the bladder is the guys have prostate and they'll be similar.
Oh, we're getting there. There's a difference in the urethra as well. All right, so now the bladder is going to be anterior to the rectum in males and anterior to the vaginal canal in females. So there's a little bit of difference in location there. There's your trigone once again. It's that triangular area of the bladder. The base between three openings, two for your ureters that dump into the bladder, and one as an exit, which is going to be your internal urethral orifice, which we see right here, guys. All right, so this is an example of a female bladder. How do I know that? There's no prostate there, right? Exactly. There's your two openings that the ureters dump into. There's your trigone, making that triangular shape. Internal urethral orifice, where the urine exits as you micturate, flowing through the urethra, out the external urethral orifice. All right, so a little bit more vocabulary here, guys. Of course, the shape of that bladder is going to vary quite greatly, depending on how bad you have to go to the restroom. It's going to fill up quite quickly, drinking all that beer and alcohol that some of my people in here just love to drink, that Mr. Norsworthy did just warn y'all about.
Shots fired.
Uh-huh. Don't cry to me about your kidney stones. Freely movable. It's going to be held in place by folds of the peritoneum. When empty, the bladder is going to sit in that pelvic cavity. As it fills, it's going to be more of an oval shape, which is why we see it make that oval shape with the contrast, when we're injecting contrast or introducing it intravenously with an IVP. We don't do IVPs anymore. I'm going to tell you about IVPs, but that used to be something that's very common, doing those as a contrast exam. Adult bladder can hold approximately 500 milliliters when completely full. Once again, urge for micturation is going to occur at about 250 milliliters. When you get that feeling that you can go to the restroom, doesn't mean you can't go before that. That's when you get the feeling that you need to go ahead and micturate or empty that bladder. For most people, unless you have incontinence issues. Have you ever known someone that has an issue with that? It can be quite embarrassing. Obviously, I've had family members that have had incontinence, and so much as like laughing, they'll end up urinating on themselves and make a mess. And it can be very embarrassing. Very, very embarrassing.
You know when they severed my urethra, I had incontinence. When they severed my urethra.
When you severed your ureter.
When they
Oh,
severed
oh,
my
right,
urethra.
right,
Them
right,
folks
right.
did that.
I remember you telling me about that.
How many times I go over this story?
I had to go back into
Yes, when
the
they severed my
archives.
urethra, that
You
was
know,
the
it's
issue.
late. It's raining outside.
It was just flowing out of me.
It was just flowing out.
That wasn't the pen.
Yes, it was just flowing like a river. I did that detention, man.
I know.
Absolutely correct.
Very good. All right.
Until they fix it. We're gonna be talking about this until I graduate.
Okay, talking about the urethra now, guys. There are differences between the urethra of a male and female. First, talking about length for your females, about 1.5 inches long. For males, 7 to 8. But also, when we break down the urethra itself, there are different parts in the male urethra as compared to the female. Females have it very easy. It's just called urethra. Males, though, we have 4 parts that we're going to label, although you only see 3 right here. We have the prostatic urethra, located with the prostate surrounding it. That's the first portion of the urethra. We have the membranous urethra, which is exiting the prostate. And where you see about this curve right here, guys, that's going to be the bulbous urethra. That's not on that diagram, but another part you need to know. And then we have the penile, sometimes called the spongy urethra as well. Penile and spongy urethra. That's going to be the rest of the male urethra.
What's the fourth one again?
Fourth one is going to be penile or spongy urethra. Penile or spongy urethra. I got more pictures to show you. It's coming. Prostatic, membranous, bulbous, and penile/spongy. Now, make note, and I always bring this up because I used to see horror stories when I worked at TCH of people catheterizing patients incorrectly. A lot of people, and you would not believe this, don't realize for females, the urethra and the vagina are two different openings. They are not the same opening. You'd think people would know that, but you'd be surprised how many people do not know that. Do not catheterize a female through the vaginal opening.
Damn.
Catheterize the urethra. You don't want to be introducing contrast in there. It's going to be a bad time. Males, a lot easier. You only got one opening, but females, you have two separate openings. Urethra is superior to the vaginal opening. Please remember that if you're ever going to be catheterizing patients. Harris Health, I don't think they catheterize at Harris Health. Yeah, do they catheterize here? The nurses do. TCH, we had to catheterize our patients. So I saw a lot of instances of people catheterizing female children incorrectly.
You've been traumatized.
Yes, you can. Yes, you can.
But when they do that hystero whatever.
Hysterosalpingogram?
Yeah, and
That's going to be a different exam where you do use the vaginal opening. And we're going to get to that in the next chapter. Yes. That's where you look at the fallopian tubes, the uterus,
If you would,
all that. Yeah.
like you said you would.
What?
Oh, I'm talking to Johns about this.
All right, so. I don't know why I have this picture.
Me neither.
This is for the next chapter. I jumped ahead on this one. So this will be for reproductive system. I don't know why I have this slide here. So we're going to come back to all this and describe the reproductive system for males and all the functions, but we're on the urinary system still, so I'll come back to that. But we can still label those parts I told you about, guys. Looking closely. Prostatic urethra. Remember, the male urethra has 4 parts. Prostatic urethra. We have the, what was next? Membranous, right here. Bulbous. And penile. Penile or spongy. Correct. Bulbous. Bulbous. And we'll come back to this one as well, guys, on the next chapter when we talk about the reproductive system. Once again, just make note. I'm saying this because I saw too many horror stories, guys. 2 different openings. If you're ever going to catheterize a female patient, please catheterize correctly, or you're going to cause them a lot of infection and pain and discomfort. Oh yeah, that was just to show you guys what I'm talking about. Whenever you're pregnant, this baby is right on top of that bladder, pressing down on it. So that baby gets to move it around, kicking. It's going to make you have to micturate a lot as a female. Yes. Isn't childbirth beautiful? Yes. Yes. All right, so talking about the prostate, guys. Prostate is something that ultrasound, and Mr. Northbury just walked out, but prostates are imaged in ultrasound quite a bit because that's an area where men are in danger for cancer, infection, inflammation, and inflammation being a really bad one because it's going to constrict that urethra. So prostate, small glandular body surrounding the proximal part of the male urethra, as we saw in the diagram. It's also considered part of the male reproductive system because of the location. It's often described with the urinary system because it does surround the urethra, the proximal portion. So it is part of the male reproductive system, but we include it in the urinary system because of its location. In fact, it can actually constrict that urethra and prevent males from urinating properly. Of course, its function is to help to create semen for males. We'll get more to that in the next section, next chapter. And you can survive without a prostate as a male. Prostate cancer is a very common pathology.
Right?
If you can survive without it,
Yeah.
you can. You can. Yes. What's your question?
But, so what is it called when you have some, like, when someone doesn't have like a leather, I think it's called
Prosthetic.
right?
What?
Not the same thing as a prostate.
Oh.
This one has a
Prosthetic. She was
Prosthetic
just getting
what?
the 2 words confused.
prostate.
Prosthetic and prostate.
Prostate is a gland in males, not prosthetic.
I
Prostate.
thought we were talking about
Prostate.
like when someone's trying to make their, testicles, I mean not testicles, their penis bigger, so I thought it was this, but
That's a penile implant that you're talking about. And that's a real thing. That's not for size, that's
I know, but I was getting the words mixed
that's
up.
for males to get erections. That's for erections.
Get your hand off your hip over that.
There's an actual implant for when a male can't get an erection that they can use to achieve that.
What you over there?
I
To
saw
answer your question.
prosthetic, and then I saw prosthetic. I was like, oh wait, I thought it was the same thing or something.
It's okay.
It's called penile implants, not prosthetics. All
Can
right.
any of this be seen?
Can we get back to urinary system now?
Can any of the urinary system be seen without barium? Like, do you need barium to
So,
light it
good
up?
question. You can see kidney shadows on the abdomen,
Okay.
but it just depends on the quality of the radiograph.
Okay.
But you're not going to see them in this kind of detail.
That's what I was
Now,
thinking, like,
I want y'all to think back to the calyces we were just talking about. You can really see them well on here,
Yeah.
guys. Remember Alice said the little small finger-like projections were the minors?
Minors.
There's your minors. See how it looks like a hand?
Yeah.
See the hand I was talking about?
It looks like that's what-
Here's your minors. They converge to a major. This is a major. This is a major. And then C would be the pelvis where they all come together to dump into the ureter.
Which one's the minor?
So minor are the little finger-like projections on the end. Minor, 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 minor. We got lots of little minors. They converge in these little tubes you see. That's your majors.
Okay.
And then this triangular area is going to be the pelvis. Come to this side, guys. Minor, 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 minor. Major, major, major. Pelvis, ureter.
Where's the
Y'all see it?
Yeah.
You do not see the pyramids on a radiograph. It's just going to be on a diagram. Little list to remember. So A would be your minor calyx. B your major. C the renal pelvis. I don't think D was. Y'all remember? One of those constrictures we talked about. Uretero-pelvic junction, not PB and J, UPJ. I keep wanting to say PB and J. Because I really want a peanut butter and jelly sandwich. Letter E, guys. If you see on a radiograph, if you're labeling anywhere in this area, this is just going to be ureters. This will be which ureter? Right ureter, left ureter. Now it's not labeled, but we had another constriction right here at the level of the crest. Uretero-pelvic brim, yes. Left and right ureter. F is going to be that third point of constriction close to the bladder. Uretero-vesical junction, UVJ. UVJ. And then G, of course, is going to be just the bladder. Just the bladder. Does that make it a little more sense now on the radiograph? It's not that difficult. It's actually a little easier, in my opinion, to identify this stuff on an X-ray than on the models. Would y'all agree? Maybe?
What was the question?
That said, I feel like the anatomy we just talked about is a little easier to identify on a radiograph than on the models.
Yes.
A little less complicated. Now, this is a voiding cystogram, cystourethrogram. We're actually looking at the bladder and the urethra. How do I know that? It's in the word. You see the word cysto, it refers to bladder. Urethro refers to urethra. Not ureto. Not ureto. What would ureto mean? Ureters. That's where it gets a little confusing. Make sure you look at that word closely. Does it say ureto or urethro?
Know what you said that was, Sadie?
I know that's a little confusing.
No, that's not.
This is a cystourethrogram. So bladder, urethra. But you can have a cystourethrogram.
So urethro is for your ureters, right?
Huh?
Urethro is for your ureters, right?
No, that's where people make a mistake. Urethro is for the urethra. Urethra.
Okay, so which one's for the ureters?
Ureto.
Okay, so that's what I
Cystourethro.
had. I had that, avoiding.
Like a burrito. So urethro burrito. There you go.
Thank you.
That's a terrible reference, but that's what it reminds me of. All right, I guess I'm hungry. Voiding cystourethrogram. What's that mean? That means they have to actually void, which means micturate during this exam. These are the ones that we don't like doing as techs because typically you want the patient to pee on the table for these. Have y'all seen these yet? A few of these. We would have to often get babies to pee on the table. Babies are well, at least in my career, the most common patients that we did these with. And it can be difficult to get a baby to pee on command. So what do y'all think we did? There's a little trick to it.
Some water.
Tickle.
Put some
Put
cold
the hand in
water.
cold water or something.
You're on the right track. You get
Water on their belly button.
slightly warm water and you just pour it on the genitals slightly. And it'll usually cause them to urinate. it'll just start coming on out.
So
We
why
would
is it
tickle the
common?
bottom of their feet too. We would kind of
Tickle the bottom of the feet?
Yeah.
I never tried the tickle method. We always just poured a little water on them and they would usually start urinating.
Why is it more common in babies?
They get a lot of infections with their urinary tract. Yeah, a lot of issues down there. Yeah, especially when they're preemies.
Oh.
So this would be an oblique of avoiding cystourethrogram. This is a male patient. Does anybody know how I know this is a male patient?
2 balls.
What'd you say?
It was not me, I swear to God. I swear to God it was not me.
That was a junior.
Oh.
Makes you hear your voice in here.
Dude, I knew as soon as he said it, I was like, Donahue, don't start.
He looked straight at him too.
Yeah, and I was like, God.
Sound like your voice.
It did. He's been punking me all day.
So, no. First off, we don't call them balls. They're called testes.
Balls.
Why can't we just talk about how long the urethra is?
That's what I was going to actually.
I thought you
that's
were
the
saying
correct
how long the
answer.
balls are. I was
That's
saying,
the
man, we doing something now.
The male urethra is a lot longer, more complex than the female. The female urethra is very short, which we're going to see on a radiograph shortly.
It makes sense.
What's that soft tissue?
So, labeling our parts once again here, guys. A is going to be the left and right ureters. Can y'all see them? That's your ureters. We're looking at an oblique. That's why it's so weird looking. There's the ureters. By the way, can you see how inflamed that is? That's not normal. B is the bladder.
Damn.
What do y'all think C is? Neck. It is, yes, it is. The neck of the bladder. What would D be referring to? It's not prostate, by the way, because the prostate's invisible on that radiograph. Prostate you cannot see on x-rays. But there's something else located there.
Oh, the prostate?
Prostatic urethra. Prostatic urethra. So what would E be?
Membranous urethra.
The collecting data.
The membranous urethra. So I'm out of arrows, but just to follow the path again, guys, because there's 4 parts of the male urethra: prostatic, membranous, bulbous, penile. Penile or spongy. Yes.
Do we have to know both the penile and spongy?
Just know it by both names. There's another picture right there, and I'm sure it's sort of a little bit blurry, but that's another oblique, guys, with all those parts we just talked about: prostatic urethra, membranous, bulbous, penile, right here. There's another view. That's one of the few. I don't think this is an X-ray. RGU. You can see the prostate pretty good on that. But prostatic urethra, membranous, bulbous, penile. Making sense? The 4 parts of the male urethra making sense? Someone raise their hand? Oh. Question, Monty? You got a question?
Prostatic urethra, is it just a line? Because it's pointing to like the side. That's the prostate.
That's the
And then
prostate.
Right above that,
I'm sorry, that's the prostate.
and that's the
That's the
prostatic.
prostatic urethra in the middle
Okay.
there. This is the membranous. We okay on this so far?
Yes.
Yes? Alright.
What's your signature on that?
Huh?
There's a signature under that diagram, like.
Oh, there's a signature there. So.
That's mine, don't
I'm distracted what I was gonna say. The signature now.
Wilson Farm.
That's what you were
I've never even noticed that before.
Wilson Farm.
Well, Mr. Feynman is very proud of his diagram.
Looks like it's Jamaica.
He's proud of something.
What if that's behind?
Well, I think I was gonna say here's well, that's
Here's
what I
Johnny.
thought I was gonna say was here's one more diagram showing the parts of the male urethra, and I'm hammering this in because people miss this every year on this test. The 4 parts of that urethra. Make sure you can label those properly. You're gonna see those, all 4 of them, on your test. And females have it a lot easier, guys. When we label the female urethra, we just call it the short female urethra.
Dang.
We don't get nothing.
You'll get nothing.
You get nothing. You get nothing. You get a bladder, you get a short female urethra. There you
And the
go.
baby sitting on it.
With a baby sitting on it, yeah. So make sure you can label them accordingly. Make sure you can tell the difference between male versus female. Pretty easy to tell. go. Let's do some review questions. Back to what Mr. Norsworthy talked about. What are the two components of a nephron?
Renal capsule and gallbladder. Yeah. C.
Tubule and renal
I
corpuscle.
got that right.
Tubule and corpuscle.
Not the capsule.
I got it right.
Corpuscle encompasses all that.
Oh, okay.
That was a trick question. I'm sorry.
I still got it right.
You did. What is the trigone?
It's a
The
triangle.
trigony is
Triangular area at the bladder base between the three openings, correct. Good, 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 good.
That's it, okay.
Are we okay on anatomy so far? That's all the anatomy for this chapter.
We think.
You think? We're not done. We still got 25 minutes.
I thought you were being nice today.
I do have some practice images I will send y'all, as I usually do, to help you with that labeling.
How about we just go through them together because
We can
like,
go
you
through them
said
together.
And I'm like, what is this?
Just to remind me, we'll go through them together. Next class.
Oh, I thought you
For real.
Can we also do the practice?
Hmm? Yes.
Yeah.
Remind me. Remind me. I think I have one already ready to go.
Did you get my email about the capstone? I mean, I know this is.
I'm gonna get to that in the class.
Okay. Since we going, through the, let that man breathe.
I got some good news.
No, oh, okay. Oh, good news.
Go
I'm
ahead.
sure I want to share it now because y'all are rushing me.
I mean, I
We'll
just
take
threw
the
that
bad
in the
news
pot
first.
of everything else.
Into class.
Okay.
All right, contraindications for IVUs, guys. Intravenous ureterogram is what IVU stands for, one of our contrast studies of the kidneys, ureters, and bladder. Why would we not do this? Well, number one, that's kind of obvious. Hypersensitivity to iodinated contrast media, some kind of allergy. Anorrhea, what is that? It's not just a pretty thing, like a good girl's name. Anorrhea.
They're unable to pee.
Anuria. Anuria. Sounds like a girl's name. What's anuria? Oh,
Bacteria.
blood.
The STD. Oh.
Blood. Multiple myeloma.
Oh, the
Wait.
TV show. That's the commercial.
That's cancer.
If you have multiple myeloma,
Yes.
Cancer.
Yeah.
Yes.
Tumors.
Cancer.
Like a cancer.
yes.
Did you say what number 2 was?
Anorrhea, blood in the urine.
Blood in there. Okay.
Diabetes, like Wilford Brimley says in the commercial. You know, I talked about Wilford Brimley with the diabetes.
No, pull up the video again.
Y'all saw
Yes,
I,
you did say
No,
that.
pull up the video.
I pulled up the video last semester.
No, you didn't. Pull it up.
Yes, I did. Yes, I did. Diabetes, get your testing supplies from Liberty Medical.
No idea what you're talking about.
Pull it up.
Live a
Pull it
better
up.
life.
Is that old?
It's pretty old.
You said multiple myeloma, malignant cancer as well?
Severe hepatic
Yes.
or renal disease. Hepatic refers to what, guys? Liver, renal, kidneys, congestive heart failure, pheochromocytoma, another cancer, sickle cell anemia, and of course renal failure, acute or chronic. Which this one right here, we're often going to check those BUN creatinine levels beforehand to make sure everything is at the correct level. Because if we see some kind of inconsistency or low or high level, it's going to be dangerous to introduce contrasts. Huh? Sickle cell. What is sickle cell anemia? That's a blood disease in African Americans. Specific. Yes. Pheochromocytoma. Pheochromocytoma is cancer of. Oh wow, it slipped my mind. Someone want to Google that? It slipped my mind.
Jesus, I'm
Pheochromocytoma.
racist, man.
Pheochromocytoma.
What'd you say, Carmen?
That says so correct. Hormones.
What's Google say?
Tumor that
What's Dr.
can
Google
occur
say?
in adrenal glands.
Adrenal glands. Thank you. Adrenal glands. All right, so some clinical indications, some pathologies that we're going to do some of our contrast studies for, and there are some weird pathologies with the kidneys, guys. I can't wait to show y'all some of these. We'll go through each of these one by one. We're going to talk about hyperplasia, bladder carcinoma, some anomalies such as duplications, horseshoe kidney, malrotation. Boy, this one right here with kids. Malro all the time. I always hear them talk malrotation. Cystitis, polycystic kidney disease, renal calculi, that's the one we should all be familiar with. and renal obstruction, also called hydronephrosis. So, benign prostatic hyperplasia, what do you think it is?
A gigantic prostate.
A gigantic prostate, yes. Here's a normal prostate. Here is a prostate with BPH. So it's pressing up into the bladder. It's also constricting that prostatic and membranous urethra. It's going to constrict the urine, causing a lot of pain, and also it's causing reflux, all that urine back into the kidneys. Reflux can be very dangerous because a waste product can cause toxicity, can actually kill you. Yes. Duplications. What do you think that is? What do you think it is? Look at it. That's duplicated kidneys.
So you got
That's,
3 kidneys?
that's 2 kidneys merged together right there.
So you got 3.
They got
Yeah.
3.
Is that bad?
Now,
So they
with
can drink
these
more.
duplications, unless there's some kind of severe deformity, they can still function properly.
Yeah, that's very rare.
So look at this, guys. This is 2 kidneys fused together, 2 separate renal pelvises, 2 ureters converging into one.
They're alien.
But it's functioning properly.
Can you donate
That's the
one?
alien. and
Yeah.
Good, I guess.
Give me a
That'd be a kidney duplication that we see right there.
If they duplicate on the other side as well, is that like another? Is it still duplication? If they,
Still duplications.
So they're like full X-Men at that point.
Quadruple kidneys, yeah.
Full X.
All right,
Yeah,
horseshoe
hey, their piss is
kidneys.
radioactive.
That's when your kidneys merge together, make an actual horseshoe shape.
Oh.
Here it is
Can
right
you
here,
function
guys.
like that?
You said what is the
Horseshoe kidney,
kidneys?
the kidneys merge together, making that U shape.
So can you function that way?
You can, but there's likely gonna be a lot of deformities going on in there, a lot of issues, I would think. Malrotation. Oh, man. I've had a nickel for every time they check for this in
It looks
kids.
like the kidney's back.
The kidney's backwards. It's twisted. Malrotation. Bad rotation. See how they're both facing the same direction here? It's twisted on itself.
Is that bad?
That's bad. That can mess you all up, yes.
Only kids.
Not
Are
only
they
in
born
kids,
like
but we saw it a lot in kids where it worked.
Are they born like that or just like?
Usually they're born like that. A lot of them, yeah.
So they go in and flip it.
They'll go in there and fix it. Yeah, they can flip it back around.
So it functions and everything. It's just.
Well, it depends on how it formed. It might be like twisted on itself and like basically clogged up, which can be dangerous. Cystitis. What does that mean, guys? Cysto refers to
In those
Bladder.
cells.
bladder. Itis means so inflamed bladder. Inflamed bladder.
Polycystic kidneys.
Polycystic kidney disease, that's a big one as well. That's whenever massive cysts form on the kidney, cause it to swell up. This is an advanced polycystic patient right here, guys. The kidneys are so big, they're actually pushing the organs up. Humongous.
How do they get that? Or they're just.
How do they get that? It's a disease. It's a disease that you can develop, genetic disease. Kind of looks like something from Aliens.
Yep.
They probably are aliens.
And there's the one that we love to hate, the renal calculi. Oh, where's my alcohol drinkers? Where's my soda drinkers?
New melody shots.
This is what you want
They look like dice.
They come in various sizes and shapes. They can be as small as powder. They can be as big as this. This is real kidney stones, guys.
Oh my
Are you
god.
serious?
These are the ones that have to be surgically removed. They're not even gonna pass. This would be what your lithotripsies are gonna break up. Where they use those lasers to reduce it into powder.
So
But, huh?
if it's big like that, they'll just go in and take it.
Yeah,
all
because
out?
it's not gonna pass. It's gonna be
Oh.
lodged. Now, these are more smaller sizes you can see on these radiographs.
Those they'll.
Well, that's a bigger one there. That's pretty big. That's pretty big. Looks like little bullets almost. So, the ones that are most painful are the ones shaped like this. When I said they're pointy, they're actually gonna like tear at the walls of your ureters and your urethra, which is why I say it's worse than childbirth if you pass these. So, yeah, please knock me out and shoot lasers at me if I ever get one of those. That's all I gotta say. I don't think I can take it. You said your brother passed one?
My brother-in-law.
Your brother-in-law. Did he pass it without like any painkillers or anything?
But he had painkillers.
Man.
But he was in bed he was in the hospital for a day. 'Cause he had another one. It was bigger, and he passed that one there. But he still had the little one. So they sent him home with like some really good painkillers when he was home the rest of the day, and then he passed it, and he was like, "Look, guys." I'm like, "Oh yeah."
Showing it off.
Yeah. And we're like, seriously?
Yeah.
Dig his hand.
So if you ever get really sharp pains, in your back, guys, sometimes that can be an indication of kidney stones forming in the kidneys. And if you feel that sharp pain traveling down your back, you might be passing a kidney stone. Doesn't mean
Or
that's
you're
what it
pregnant.
is. Or you're pregnant.
Wait,
Or
what
you're
happened?
pregnant,
What did you
yes.
say?
Huh?
What did you just say?
I said if you feel a radiating sharp pain in your back that's moving down, you might be passing a kidney stone, but it might could be other things as well.
Or gas.
Yeah.
Forget
It could be gas, it could be that Taco Bell. Man, I got a bone to pick with Taco Bell. They're freaking expensive now.
Oh, yeah.
For
Yeah.
some, that they open out the
I
package that just says
I took my
meat.
family out to Taco Bell the other night. It was like
Hey.
$35.
Hey, Chara, you wanna know what that is?
Not even
I
one.
never buy books.
I'm like,
Grade D.
all the fast food is like
Yeah, just order pizza.
absurd.
I went like weeks ago. I like Domino's.
Yeah, and then my stomach becomes completely bonded.
Oh, Wendy's had the little combo thing.
The biggie bag for $6.50.
Oh, Wendy's. I don't like Wendy's though.
What?
Wendy doesn't like you.
Yeah, it doesn't. I'm a bad version of the name Wendy.
Oh.
Oh, did I say that out loud?
A bad aversion to the name Wendy. The girl that broke my heart.
Oh, okay, anyway. CT hydronephrosis, basically water on the kidney, guys. Water on the kidney. It's a swollen renal pelvis. You see right here. Very common in babies. That's hydrocephalus, thank you. Hydrocephaly.
Yeah.
All right, so contrast studies. Why do we do these? Primarily to demonstrate that renal parenchyma, see all those internal structures better. And typically we're going to follow it by x-rays or CTs. A lot of these patients do go to CT. CT is going to be one of the best mediums for evaluating the urinary system. We're going to use two filling techniques, not both, either antegrade or retrograde. What in the world does that mean? That's two very important terms to make sure you know for not only this test, but for your registry. Antegrade means what?
Forward.
We haven't used that one yet. Well, let me go backwards. What's retrograde mean?
Flowing back.
Flowing back. So if I'm injecting contrast into the urethra and it's flowing through the bladder up the ureters, that's retrograde filling. It's working backwards. But if I am doing the reverse of that, that's going to be antegrade. So in other words, if I introduce contrast into the veins with an IVU, which is something we don't do anymore, and we watch the urine go through its normal path, that's antegrade. So antegrade's the normal flow, retrograde's against the flow. Make sense? Antegrade, retrograde.
Does it hurt when you do it the reverse method?
I wouldn't think it's comfortable. I don't know, I've never had it done, so.
No, like people would have.
They say it's uncomfortable. Yeah, yeah. I think the catheterization is the worst part though, honestly. Yeah.
So is barium enema retrograde?
Yes, it is. Very good. Very, very good. All right, so lower concentrations for contrast are going to be what we use for our bladder studies because we use a very large amount to fill up that bladder. We'll use higher concentrations for excretory urography. In other words, the exams where they urinate out the contrast, excretory urography. Non-ionic media, and we should know this like the back of our hand now, guys, is less likely to cause what? Adverse reactions. It's our safest medium always. Anytime you see a question on your registry about the most safe contrast to use, we always go with non-ionic. Why is that the safest option? From a chemical,
Lower
chemical
osmosis.
it dissociates. Ionic dissociates into particles, non-ionic stays together, thus causing less overall allergic reactions. So, most of our contrast studies, especially in the kidneys and the bladder and the ureters, because it's such a sensitive area, we're going to opt for that non-ionic contrast medium. Question, Jen? Yes.
But then if there's barium sulfate, that's the safest.
For GI, we are not going to use barium sulfate for urinary studies. Good question, by the way. Please don't shoot barium. Please don't inject barium into the urethra. That's going to be painful. Very painful.
That's
Very
picky
thick.
thick.
Very, very thick. It's going to
Picky
clump
thick.
up. Yes. Yes. Ooh,
Taco Bell.
worse than Taco Bell. All right, so talking about our contrast reactions again, guys, a little bit of patient care review. If we have contrast medium, what are you doing up there?
Somebody didn't practice patient care.
Getting ready
If
to
we're
go.
having adverse reactions, usually they'll be mild and short. Severe reactions, of course, can occur but are rare. What's our most common reactions? The feeling of warmth, flushing, and a few hives sometimes.
He looked like he got a lot.
That's a lot of hives. But,
But that's not mine.
huh?
That's not mine.
That wouldn't be minor, but that's probably a bad example.
Yeah, it's not mine. It's severe.
That's a little
one.
more severe, yeah. All right, occasional reactions to our contrast would be nausea, vomiting, and edema of the respiratory mucous membranes. Our severe, even though they are rare, severe and serious reactions are rare. That's gonna be like your cardiac arrest, extreme high blood pressure, extreme hives, extreme vomiting, they stop breathing, things like that when it gets more severe. Check the clinical history carefully. This is so important because once again, we're going to be checking those BUN and creatinine levels anytime we're dealing with the kidneys to make sure the urinary system is working properly. Because if it's not, it can be extraordinarily dangerous to introduce contrast to a patient whose levels are off. And I've seen cases of that happen. And if someone is given a contrast when their kidneys are not functioning correctly, they can end up on dialysis the rest of their life. It can completely destroy their entire urinary system. So observe closely after contrast, and of course have all that emergency equipment on standby, just in case something does go wrong. All right. Oh, everyone's packing up for. We still got 10 minutes.
Hey, that's how long it takes
Such
me
a
to get my
hurry to get out of here.
And when them 10 minutes come up, I'll be gone.
So you decide whether or not we should finish.
Hmm. Now, for our urinary procedures in fluoro, they do need to have the bowels free of gas and fecal material. Why?
So you can see.
So you can see. So you can see. The intestines, if they're filled up with fecal matter, gas, it's going to be very black on the radiographs. It could actually obscure those ureters, the bladder, everything that we need to see. So bowel preparation is not going to be in our infants and children. That doesn't matter. It's only for adults. And adult prep is going to depend on their condition as well. Patient prep. So for urinary exams, low residue diet. Please put a note on these guys. Y'all missed this question a lot in the last test about the different prep times. Low residue diet for 1 to 2 days before the exam. Light evening meal on the day before the examination, so you're not doing a total fast. Non-gas forming laxative when indicated the day before the exam, and nothing by mouth after midnight the day of the examination. Yes?
What's low residue like?
Low residue is like, you're not gonna eat like heavy solids.
Like Taco Bell.
Like Taco Bell. You're gonna eat like soups and things, yeah.
Jello.
Soups and salads.
Jello.
Jello. All right, patient, of course, should be almost dehydrated. Well hydrated. If they're dehydrated, that's actually a bad thing. That can actually cause a lot of issues to a patient having a urinary exam. Very important for your diabetic patients, multiple myeloma patients, and people who have high uric acid levels. And of course, if they are severely dehydrated, they're going to be at higher risk and can actually have renal failure from dehydration.
How do you
Yes.
know if they're dehydrated?
Should be in their charts.
Oh, okay.
Should be in their chart. They should have had someone do a whole readout for them before they come over. Full check on them. If it's not their chart, you want to follow up with the nurse. Better safe than sorry. All right, and then for retrograde urograms, the patient should drink 4 to 5 cups of water several hours before the exam. That's to flush everything out, get everything prepped for that examination. And usually we're doing the lower urinary tract. We're talking about the urethra specifically, like our voiding exams. Usually you do not need prep for those because we're just looking at the urethral area. Mm-hmm.
I have a question.
Yes.
So like since this is fluoro, like do they pay you more because you work on the fluoro side, or is all the same?
No, it's considered diagnostic X-ray still.
This is too much. I was thinking a little.
They may eventually do that way. I don't know. For now, it's just diagnostic X-ray.
So it shouldn't
All right.
Specialty?
Huh?
It's
It's not a specialty.
specialty.
It might be eventually. They're moving so strongly towards fluoro, especially on the registry. I wouldn't be surprised if they make it its own modality eventually. Get some more money. So let's talk about your capstone, since that's been on everyone's mind.
That's not.
So after convening with my council or faculty,